Well, Oregon State University continues tracking COVID spread through their trace testing program. This morning, they say Omicron is overwhelmingly present throughout the state. Emma Jerome is live after speaking with university officials about their contact tracing efforts. How are things looking right now, Emma?
Morning, Emily. Contact tracing, not so much happening with the TRACE program at OSU, but what they are testing is wastewater, and that will test community spread. This is a program that is spread across the state. It's in 40 different communities with people who are with communities that have 5,000 and less people. And this is all to tell where the prevalence of the virus is for those who might not normally go out and be tested. The TRACE program began in spring of 2020 and was one of the first of its kind in the nation, where people would go door to door testing people for COVID in Corvallis, Bend, Eugene, and elsewhere. The university said it was important that their engagement in public health is as present as any other one of their research sectors. I spoke with Steve Clark, he's vice president of Oregon State. He says with more than 34,000 students total, it's important for them to track these numbers so they can improve their own public health and cater to wellness on their campuses.
To be vaccinated, to get boosted, to wear face coverings, to limit their social engagement in very protective ways so as to enhance their own health and community members' health.
That's the mission of this trace testing, according to Clark. But as far as traditional contact tracing, it appears all but gone, especially on the university and maybe even statewide. Full disclosure, I tested positive for COVID about a month ago, and I never got so much as a call, email, or any correspondence from the Oregon Health Authority or the CDC. I did get a letter from the Multnomah County Health Department 7 days after I had tested positive, when I did reach out to both OHA and the CDC trying to find out what happened to the contact tracers in this program as a whole. I never heard back from them, but according to the CDC website, they claim that the program is still up and running. Emily.
Yeah, small sample size there, Emma, but it certainly sounds like things are not where we hoped they would be with some of that contact tracing.